Hi, good morning, everyone. Hope everyone had a good weekend. Hope everyone was staying safe and healthy, practicing social distancing. Um, Today, I wanted to talk about why the restrictions, the extreme restrictions, are necessary. Um, we saw people get arrested um, this weekend for having social gathering, a pop-up wedding um, in Lakewood, where the sponsors of that were arrested because of the number of people there. So the government is obviously taking the restrictions extremely seriously. Governor Phil Murphy has actually come out and said that people can expect that there will be arrests if there are gatherings that violate the restrictions. So, is it really necessary? I know some people feel that, that the response when there really aren't that many cases aren't necessary. But I want to take a quote from Dr. Anthony Fauci. He's, in the administration, he's leading the response, thank goodness. He's a great doctor and a compassionate human being. So when people asked him about the restrictions, he said, some will look and say, well, maybe we've gone a little bit too far. The thing that I want to reemphasize, and I'll say it over and over again, when you're dealing with an emerging infectious disease outbreak, you are always behind where you think you are if you think that today reflects where you really are. Let's say that today we found 1,000 new COVID-19 cases, but the virus has a 2 to 10 day incubation period. So in the past week or so, all of these people that were found were exposed to the virus. Then they got sick, and they got sick enough to seek medical attention, which can take a few more days. Then they got the test. Then tests have been taking a day or more to return. In the meantime, they have exposed other people. In this type of virus, the estimate is that they've exposed and will have infected 2 to 3 other people. So you can see why the exponential growth, if each person is infecting 2 others. That is what it looks like without strong social distancing and restrictions. So we want to slow that exponential growth. You can see that some countries were not very successful. Italy, for example, they took restrictions, but they took them slowly, rolled them out, and their numbers continued to surge until they essentially locked down the entire country. China, South Korea, Singapore, and Taiwan, on the other hand, took extreme measures, and now their cases are much less. South Korea was testing a good portion of the population, so we could see from there that their mortality rate was maybe about 1% of total cases. Whereas in countries who are testing less, it's about 3.54% of confirmed cases. So those numbers are different because in countries with under testing, there's a lot more cases that are going undiagnosed. So the mortality rate looks higher, but is actually lower compared to overall cases. But South Korea, I think, gives us a good barometer of what if you're testing a large portion of the population. So, we want our numbers to start to look more like, China and South Korea, where the rate of infection slows and then stops, rather than Italy's, where it's seems like it's stabilized, but I don't think it's actually starting to go down yet. because we don't want our health system to be overwhelmed. We don't want our vulnerable populations to be infected. So, that's why the severe restrictions, that's why we're unsure how long they're going to last. But we want to see that curve flatten. We want to see that curve bend before it gets out of control. There are now 35,000 cases in the U.S. and we want to see those numbers start to slow down. That looks like an increase of 9,000 cases since yesterday and 16,000 cases since Saturday. So, as I said, we want to see those case rates slow down. So, good morning, Michelle. Good morning, Marcia. All right. Well, if anybody has questions about coronavirus, heart disease, immune support, please let me know. And once again, we have our immune support group that you can get updates there, ask questions there, get advice on how to keep your immune system strong. Because as I said, as I mentioned above, if somebody is infected for 10 days to 2 weeks and they infect 2 to 3 others, well, there are a lot of people they had been coming in contact with who didn't get infected. And we want everyone we know to be in that group. So by supporting your immune system, by doing all the lifestyle changes, sleeping well, and being active while maintaining social distancing, eating well, that you can give yourself the best chance of not getting infected. If there's any questions, you can, as I said, put them below, and or you can contact our office. Hi, Nancy. So, yeah, please give me your questions. Please give me ideas about what you want me to talk about, and I'd be happy to do that. And I will be back on tomorrow at 8 o'clock. All right. I will see you then. And be safe and be healthy.